Hello and welcome. My name is Dr. Rizwan Qureshi, and I'm a consultant in emergency medicine in Sydney, Australia. And here we've got a very close friend and a very big inspiration, rather, Dr. Shashi. Dr. Shashi may not realize that, but I attended his course when I was doing my fellowship exam. That was in Brisbane. That was back in 2015. And I managed to pass my exam after attending that course. So I hold a very deep regard and draw a big inspiration from you, Shashi. And Dr. Shashi has been now working as a consultant in Newcastle. Dr. Shashi also is an IMG, yes, international medical graduate from India, and would like to sort of very slowly explore and tease a little bit out from him as to how the life was back there in India and how the life here now compares to all of that. So Dr. Shashi, welcome. How are you, sir?
Thank you very much for the introduction and for your generous words. I'm doing well, and thank you for inviting me to share my story.
Always a pleasure, Shashi. You don't know how many people you are actually lively sparring right now. So your story is very interesting, and I was thinking of contacting you for close to about a few months now, but I just couldn't get the time. So this is in a series of various podcasts which I'm going to do in terms of reflections on personal journeys and somewhat achievements we have somewhat achieved to some little degree, if you agree with me. So I think it's very engaging and perhaps offers a little bit of inspiration to young IMGs and young doctors, a future emergency physician. So I'll start by saying, Dr. Shashi, tell me something about yourself. Take me back to your past. Where were you born?
So I was born in a South Indian small town called Karapa. It is in the state of Andhra Pradesh. And I grew up all my early childhood and being up to an young adult within the state of Andhra Pradesh, which is where I did my medical school. So I'm from Andhra. My mother tongue is Telugu. But throughout growing up and everything, I've managed to learn other languages, including Hindi, and English was the medium of instruction for me.
That's what I was thinking, that you managed to absorb a lot of languages, Hindi, and we were talking about a little bit, you've got a little bit share of shairi, and now are you doing English poetry as well?
Yeah, I do prose better than poetry, I feel. For me, prose itself could be poetry too.
Fair enough. Fair enough. When it's coming from an authority and a bit of an experience, yes, it is like a biblical.
Yes.
So tell me about the life back in South India. How was the life back home? How many brothers and sisters were you? Were you the naughty one, or were you the studious and nerdy one?
Well, I have to probably thank that I've been very lucky to actually have an upbringing in a family that I have. So I'm the youngest of four.
Wow.
And I was the pampered, and I was the most competitive, and I was the most what's the word, naughty, but also stubborn.
Oh yeah, yes, that's the trait, right? The youngest of the four or the fives is the star of the eye candy, and they get all the attention, they get all the favoritisms. So yes, I was the eldest, so I can completely understand your affection or parents' affection for you. So your
Yeah, look,
childhood was sort of littered with some sort of naughty, but at the same time you were a bit stubborn. And how was the school days? Did you like school? Or I hated school. Honestly, I hated school.
yeah, look. I actually enjoyed school, and I used to enjoy learning, reading a lot of books. And one of the things that I was always interested in is to compete with my brothers in everything they did.
Yeah.
So it was almost like a game for me to try
Mhm.
and do what they're doing. I was always highly inspired by what they did. And those sorts of memories of how they look after you, how they care for you on the playground, off the
Yeah.
playground, but while still, playing and growing up. meeting their friends. One of the most exciting things I always felt was to actually not spend more time with my friends, but
Yeah.
try and spend more time with my brothers and their friends. And so,
I was just going to say that not your sister's friends.
not my sister's friend. She was the eldest, so from that point of view, there was a bit of an age difference, but the other two brothers were a bit closer. So, but my sister used to. She still reminds me that she used to hold my hand and take me to school.
Yeah.
So that's a very sweet memory and fond memory that she always remembers and reminds me of, and to just embarrass me a little too.
So, what was the environment like getting into the med school? Was it quite competitive? Like you had to study very hard? Were you having some inspiration from your brothers and sisters? Like, what was it like back in India, or what is it like now compared to your time? Because you moved into Usmania Medical College, I believe, which is in whereabouts is it?
In Hyderabad.
In Hyderabad, that's right. So, how was it like from South India to Hyderabad? How was the competitiveness like? Did you study long hours, like burning the midnight oil and ratifying the notes and everything? How was it like? Tell me.
So yes, medical school entry has always been extremely competitive. Um, to give you an example, we had nearly 40,000 people appear for the exam at the time. And it is highly competitive. And you're right, my brothers and sister, my sister is a dentist, and my two other brothers are now specialists, but they were all in the medical field. And I kind of give the credit to my dad, who is an orthopedic surgeon. So I was lucky in a way that I had plenty of guidance, plenty of inspiration when I was preparing and also getting myself ready for the exams. I received all their knowledge, their wisdom, and which made it easier for me in a way to get into medical school. Usmania Medical College is the top medical college in Andhra Pradesh,
Mm,
and to get a seat there is something everybody dreams of. So
really?
I had been lucky to train and have a dream come true for me at
Yeah.
the time. Um, I was 154th in the 40,000 people
Mm,
who
mm.
appeared for the exam.
Wow, that is such an inspiration. So you were obviously primed up by your parents and your brothers and sisters. The overall environment in the house was sort of study front. Uh, Compared to I'm just comparing myself automatically, just thinking about I'm such a cheat because I was in school. I hated school, and when it came to the medical school selection, just 2 years prior, so we had an intermediate board. In those 2 years, I just thought, man, Rizwan, you got to straighten up your act. Otherwise, you're not going to get into med school. I studied like crazy, and my memory was probably at peak at that time in terms of memorizing, just absorbing all that knowledge without even thinking through. And I managed to, like you, get into the one of the top medical colleges, Dow Medical College in Karachi, Pakistan, which everybody's dreams. Like there are only two medical colleges which are in government sector. It's Dow Medical College, and then Lahore, it's King Edward Medical College. So I meant because I was in Karachi, so I managed to get through that. But my side of the story was pretty much focused on the last 2 years. Make it big, and otherwise nothing's going to happen. So that's good. And how do you find, like in med school and going to the wards and all that house ship, do you think that you started thinking of emergency medicine then, or was it after you came to Australia? How was it like then?
That journey was very interesting. I think while I was in med school, all I remember was having plenty of fun. That's the only thing I remember, because up until that time, I think, like you said, I was focused and also being helped and guided to make a career and also shape your life, kind of thing. So once you get into the medical school, you achieved your dream. So now it's the time to party. So medical school, my most fondest memories are a great group of friends who were there all the time.
Yep.
We had some good times, some wild times, and that is pretty much what I remember. The medical school, because of the way the curriculum in India is set, there is a good emphasis on learning principles and
Mm.
learning the core subjects, and also going through each and every of the building blocks. So those sorts of things, when I reflect back, those are really useful. And I never thought I would end up in emergency
Yep.
when I was in medical school. But in my very first year as intern, one of the first rotations was in the casualty,
Yep.
the old name for emergency room. And that is when I realized I can actually do a lot more things. I was able to see myself thinking on the feet, taking quick, rapid decisions, being able to do those sorts of time critical actions or decisions and treatments. And this is where when I actually enjoyed the most at the very first time as a taste of what emergency medicine was. And then how I ended up in ED training in Australia, I actually did emergency as my very first term
As
as
a
an
house job.
intern
Yeah.
in Australia. That was my first term that I did,
Okay.
and I absolutely hated it. Because I think it was a combination of things: being new in the country, um, trying to understand a language, trying to understand the culture, not finding your feet in a complex health environment, and feeling the sense of a certain expectation that is expected of medical staff in the Australian
Mm.
health system from the word get-go. So those sorts of things probably impacted on why I felt quite disinterested, and also absolutely hated ED for the first few weeks I was there.
Yes.
And then I went to complete my rotations in every other field. And I started to realize, oh, I like
AD
respiratory.
was better.
No, I started liking everything else. So I
Okay.
liked respiratory, I liked ONG, I liked urology, I liked ENT, I liked.
I could see myself as a urologist or ONG and
So
pediatrician.
I did all those terms, and I started enjoying all of them. And then, as a first year RMO, I did an ED term. And then I realized I could do all these specialties in ED, and I was much more comfortable in the health system. And that's when I realized my kind of attraction, or also some sort of connection towards emergency medicine
Mm.
and the various challenges it kind of gives you, where you're constantly problem solving quite distinct set of challenges at
Mm.
any one time. So those sorts of things. And also when I looked at the various training pathways and everything, emergency medicine at the time had one of the most well-defined and clear training pathway, which meant that I was naturally attracted. I had a clear pathway of what I am meant to do, how many years of training, what sort
Yeah.
of assessments, examinations, and so on and so forth. And also at the same time, there was a great amount of support by the emergency physicians. I got to know them better. They were one of the most friendly, collegiate, and easygoing guys.
Yeah.
And I also started enjoying my days off during the weekday,
Yes,
and
that's a
and
big plus, isn't it?
and I didn't mind. And in the compromise, I didn't mind doing weekends. I didn't mind doing evenings. I didn't mind nights.
Because you go
Uh,
out suddenly in the shopping center and the shopping center is empty, and
exactly.
during the weekdays, and you like it. Look, this is actually, I could get used to it, and you want to in those days the payment of the bill was up in the post office. You can go to the post office Monday to Friday. It's easy to set up the meetings, work
Yep.
around the schedule. So yes, I completely resonate and completely relate to that experience. Now, coming back to your from India coming to Australia, why did you think of Australia? It's not something which is very common. Back home in Pakistan, I get asked this question lots of time. Why Australia? So my journey was obviously a little bit different to yours, because I did not come to Australia as my uh, go-to destination. I ended up being here by a set of beautiful circumstances, I'd say. Um, But what about you?
Yeah, look, through medical school, I had many peers and also seniors who, like you have either gone to the UK or US. This used to be the big two destinations. And a couple of years before I was about to finish, I was hearing that UK was more or less saturated, and there were no particular job opportunities or anything.
And when was that? Which year are we talking about?
I think this was 2003, 2004.
That's right. I was in the
Um,
UK at that time.
yeah,
Luckily, I was already in the medical workforce, but I can completely understand. Uh, my duration to getting my first job was close to about a year, or probably more than about 14 months coming to. So, yes, you're right.
and at the same time, I also from the US because my brothers, one of my brother went to US and the other one went to UK. That is their
Mhm.
first journey out. I could hear that even US is getting tougher or becoming challenging.
Mhm.
So I basically said, okay, why don't we just go to somewhere else where there may not be enough competition? Um, so that was one of the reasons for selecting Australia.
Yep,
The main reason for why even go out of your country, I think I was kind of lucky growing up to have influence, Western influence,
that's right.
in a way that from hearing music to watching various TV shows, it is fairly influential at a young age for you when you are trying to do something with your life
Yeah.
and everything. So I was definitely infatuated in a way with.
Oh, we've been brainwashed. We've been brainwashed right from, the kid old days, Knight Rider and Airwolves and all these fancy soap operas and Michael Jackson. I can completely understand that. So here
So
you
that
are.
is that is probably the why, and also seeing my own family members, like my brothers and sisters, migrate was probably a very strong reason behind why I
Yeah,
actually wanted to leave
yeah,
India.
yeah.
And the destination choice of Australia was merely because why don't we just go to a new place? And I ended up being the black sheep of the family who crossed the equator. Everyone else has been on the top half.
In the southern hemisphere. Fair enough, fair enough. And so when did you come to Australia?
I came to Australia in 2006.
2006. Okay. And where did you first come?
So
Where did you land?
it was in Adelaide.
Hmm.
And
So tell me about your first few years. How did it all pan out in your circumstances? Was it as good as you thought? Were there some challenging times, or how did it
uh,
all go for you till your
it
first job?
was,
So moving into Adelaide,
yeah,
Australia, and then
it
your
was,
first job.
yeah, it was one of the most challenging and most stressful times of my life, is how I see it. Partly because I'm away from home. It doesn't hit you until you actually are away from home
Yeah.
for the very first time. It is far, far away. You don't have your friends around you. You don't have your food. You're in a new environment. Everything is new. Everything is a challenge. From finding things to anything, it is
Mm.
a challenge. You know that you can speak English, but it is not the same as
No.
actually understanding the culture and being able to survive or thrive in a new place. And that hit me in a big way. I did my AMC very soon after I've arrived, part one. And in South Australia, I was lucky that they managed a database for IMGs at the time. I'm not sure if they still maintain that.
Mhm.
So I put my application as soon as I got my AMC result. I still remember the day I got my AMC result. That was the first exam in my life where I felt I could fail, but also that it would have a huge implication on various things for me.
For the
And
rest of your life, pretty much.
exactly, and I could feel the gravity and the burden
Mm.
of that uh, of that result. So when I received the letter, at the time they would send a letter,
Mhm.
and you get it on a Thursday, and they usually post it on a Monday or Tuesday. and they tell all these things too, by the way. So I was going back and forth first thing in the morning to the mailbox to check when I'm going to get the result. And I opened it. I was shaking. I was nervous. And when I opened and I read it, I read that I was passed.
I
That
thought you
was
were going to say,
like
oh.
that passed, and that was as relieving, and also it was an unusual set of experience that I
Yeah.
got. And just before that, I was contemplating actually going back to India.
So how long had
So
you been in Adelaide by that time when you got your
only a
result?
few months. Only a few
Okay,
months.
so it wasn't you here for
It wasn't
years on
long.
end.
No, it wasn't long. So
And did you come on a visa here, or how did it all come?
yes, yeah, on a visa, I came
So
in,
right from
and
the very core, you were trying to make it big, very much on your own. You were not like blessed with a
yes,
permanent residency or a de facto spouse or anything like
no,
that.
I was
It
by
was all
myself.
my way or no way.
Yeah. So I was by myself. I gave this exam. I felt really horrible. I had to wait another month. I was seriously for a whole month reconsidering my whole decision of coming to Australia. I was even making plans to go back and trying to get in touch with mates and everything to see where I can join and get a job again or start specialty training and all those sorts of things. And then the result came, and I applied to the database, and I said, I'm going to just forget about all of this, and I'll have a bit of fun while I'm in Australia. And I went to Brisbane and Gold Coast.
Yeah, and that changed your perspective. All those
And then
memories of Baywatch and everything was back. This is something which I was. Where is it? In Adelaide, you don't get any exposure like that.
Adelaide was still good place, but I wanted to go somewhere
Oh,
else.
come on. I think Adelaide, everybody wants to leave the air, move out of Adelaide as soon as they.
I still have really good memories of Adelaide. I really like some parts of it. I understand what you're saying, but
The amount of celebrities who have come out of Adelaide, I'm just gobsmacked. There are so many, and none of them are actually now based in Adelaide. They're all
no,
scattered around in Australia.
we all start there.
It's like, the same dilemma. It's a very beautiful place, same as New Zealand, but
Yeah,
most of the New Zealanders want to come to Australia at some point in
exactly.
their life.
Yeah.
All right. So here you
Um,
are, you got your result. Then what happened? You
so
went
that's
to
what
Gold
happened.
Coast and you thought,
So
okay, fine, I'm going to stay here. And
no,
then what happened?
so what happened was I got the result, and within a couple of days I put my application in the database, and then I go away to Gold Coast, and I just wanted to forget everything. So I wasn't checking my email, and in those days you check your email once or twice a week,
Oh, yeah.
right? It was not like every 1 minute here now. So I put the application, and I basically was still contemplating, look, okay, whatever has happened, I still want to go back to India. I'll pass this exam, whatever the result means, I don't care. Or it may mean something, it may not mean anything. And while I was holidaying, it was a couple of weeks since the result, and somebody just calls me on my mobile and says, have you not been checking your email or something? And this turns out to be the HR department at Flinders Medical Center.
Okay. Okay.
They've been sending various emails to try and get me for an interview.
All right. So quite lucky from that point of view.
That is what I'm saying. So if not for the database, I would not have had the break. So whoever set up the database, my huge thanks to them. They took the application and immediately sent it to all the seven
So what is
hospitals.
the database? Is it like a government maintained database, or is it like a
Yeah, it
state
was.
maintained, or what is it like?
It was SA Health maintained. It
Mm-hmm.
was part of their IMG and health recruitment, medical
Mm-hmm.
recruitment branch, where they would receive applications from any IMGs.
Mm-hmm.
And to apply, you needed to have at least cleared Part 1 AMC.
Yeah. Yeah.
And you should have obviously the English language test and other requirements, but the most important one was you should have passed AMC Part 1, and they
All
didn't
right.
care. They didn't, and there was no requirement that you should have a registration. So
Mm-hmm.
it is for people who say, I've got a medical degree, I'm an IMG, and I have cleared Part 1. And if you show your English language skills are appropriate, then they accept your application.
All
What
right.
they
So
do
not
is,
even an English test at that point.
no, you should have cleared your English
Okay.
test.
Okay. Okay.
Yeah.
Okay. Mhm.
That was part of the visa too anyway. So
Mhm.
so what they do is they take that and then distribute it to all the hospitals, like a JMO recruitment
Mm.
for every hospital. So
Okay,
I
within the
think that's
state.
within the state. So I don't think it exists. I'm not sure if it's still like this. It would be good to actually see if there is still that process or pathway is
I think
established.
those times, Shashi, might have been when,
Changed, yeah,
oh yeah, I mean, I think those times were very desperate times, mainly for Australia, because they were
yeah,
looking for so many IMGs compared to now when they're still looking
yeah,
for IMGs. But I think there is a flood of IMGs coming from the UK and
yes,
other sort of Western equivalent kind of system.
absolutely.
So I think in South Australia would never been on the top list of UK doctors.
Yeah,
I don't think even now, it's not
yeah,
very,
it's not.
it's
Yeah,
not
they get the
favorite
same.
place.
They get the same back home.
They get the same back home. That's right. So I think that was the time then. But now, even though the IMGs are still struggling, I don't think there's a list exists. So, what was your first job? Like you said that you started in emergency. Was it in Adelaide or which
Yeah,
hospital was that?
in Flinders Medical Center. So what happened was they were contacting me constantly to try and get me to interview. It was an interview that was almost like they gave me the job. I think they were very desperate at the time. So it was not an interview of for
It
a
was,
job. It was
when can you
interview.
start?
Yeah, what are the things that we need to get you? Do you have a car? Can you? These are the can you come and travel, or do you need to use public transport?
I
Uh,
see.
this is the sort of interview I had. It was really funny in a way, um, and uh, and basically I accepted the position. Obviously, there was no other alternative.
I wish more interviews were like that. And now, like you get question asked about your like half the biodata, then you're dealing of the complex clinical scenarios, and your
Yeah,
clinical governance and clinical risk management is just so artificial now.
yeah,
And it makes you so anxious, the interview process.
absolutely.
And
Look, I think
honest,
yeah, you're absolutely right. I didn't have any of those questions.
so here you are. You got your first job. How was your first week like in your job?
The first week was actually the first very week they got me to shadow an intern. What has happened is I came to Australia soon after I finished my internship in
Mm,
India. So I
mm,
actually did not work in India as a doctor. So
mm,
medical school internship, and then I came here straight up. So I was also very happy that they offered me an intern position where I can actually start at the bottom of the ladder and learn everything from there on.
yeah.
So they got me to shadow an intern
Hmm.
for a week, and then soon after that, I was on a geriatric ward that I started.
Hmm.
But then they put me into ED because they had vacancies, or they had to cover something.
Mm,
So I started there.
hmm.
So yeah, I don't remember much about the week in a way that I can give you details. But what I realized was one of my most challenging things was I could see that the patients were sick and they needed help, and the communication, I felt I was not able to completely grasp what they were saying,
Mm,
and I felt a level of kind of a helplessness in a way that I
mm,
was unable to, help them or communicate to them or understand what was happening,
mm,
um, and uh, and being from India and the subcontinent, we speak more of a prose or a written language, even
yep,
spoken
yep,
language,
yes.
versus a casual language which is spoken here. So there was a bit of a disconnect there, and the process of trying to understand various parts of the complex health system. Those are the two things that I thought I struggled with. But what I remember was everyone, particularly the doctors, nurses, and everyone, they were very helpful. As long as you go and approach them and say, look, I am not sure, I'm trying to get answers, I need some
Yes.
help. If you say those key words, I realized immediately that people were forthright in telling you what to do or how you can find your way or to come and help you. So,
That's so
so
right.
Yeah, so that is probably what I remember. But the reason why I didn't like emergency is partly this. When I reflect back on it, this challenge was the most obvious in the emergency department setting for me compared to the
Because it's
ward
such a
setting.
high place environment, like high paced environment. You got people
Yeah.
coming in, you're expected to see patients very quickly, very sort them out, discuss them early. And I think you are right. I remember the only two ways to survive in the system from the very beginning, either to say, look, I don't know anything about it, I'm having even trouble understanding you, can you just speak slowly and please help me? Then you'll have the sympathy vote from all the nurses, especially because you'll be interacting a lot with nurses and the consultant and registrar. So it's good. In fact, it's advisable to have that sympathy vote, even if you have not worked or if you've worked in the system. The other thing is that you just are acing everything because you're down on your first or second job and you know how the system works. But I think I find being the novice approach or being a little bit more stupid approach, that look, I don't know that, this is a new hospitaling system, as you said. I remember this first time when I started in the UK and the nurse asked me my name. I said, my name is Dr. Rizwan Qureshi. She said, what? And I said, Rizwan Qureshi. She said, is there a shorter version of that? I said, no, that's my full name. So she said, okay, can I call you by your first name? I said, okay, is that allowed? Really? I said, yes, you can call me Rizwan. She said, I'll shorten it even further. How about Riz? And then there was another JMO along with me on my side, and he introduced himself. Hey, I'm Matt. And immediately clicked off with half a dozen nurses there. And I thought, okay, so that's how things get done. Right from your introduction,
Yep.
you have to make things easy for them, and then they will come and do their part in terms of making things easy for you. So yes, I completely relate to that experience. So when did you get the hang of it? Like, how long did it take for you to be comfortable around in that system? How long, in terms of months or years, or what was it like?
This is a slightly complex answer and a very good question. I still don't feel that comfortable. I'm also partly alluding to the fact that there are various levels of um, uh, uh, comfortableness or confidence or ease that you might find in a complex health system. I think what you're talking about is operational comfortable
Mm,
versus leadership comfortable
mm,
versus and the various shades between all of that.
mm,
I think there have been various stages where I felt comfortable along the way, and I think it took me at least the first 2 years before I actually felt comfortable in the health system. The first year was when I was doing internship. It was just mostly learning a lot of logistics
And
and
Shashi, what do you think helped you in terms of, 2 years is a long time. People don't have that kind of luxury now, because, at 3 months term review, you may get a bad review or a bad reference. You need to apply for a job for the next year. You need to collect the references. What can happen to improve or reduce that time for an IMG to improve on those traits of communication, understanding of the local health system whilst being at job? What do you think worked for you?
look, I think what worked for me was being never giving up on trying to learn. I think you have to demonstrate that, and in a certain honest way, and
Mm,
also and you need to put in your effort.
mm,
Um, it is this is where some of the cliche things of actions speak more than words. You
mm,
can't just keep saying, "I want to learn, I want to do. Can you help me?" But you actually need to do that, and also
mm,
when you're learning, you need to implement that and consistently build on it.
mm,
Uh,
mm,
and uh, I also had a difficulty with one of my terms,
mm,
and I had an unfavorable midterm assessment
mhm,
in my first year of internship,
mhm,
and it ended up being a simple miscommunication between how I was uh, uh, thinking I was performing versus how I was being perceived.
mm,
And it was a really great way when I started to learn, okay, this is what it means. To give you an example of exactly what the situation was, I was an intern, and I was busily doing all the work behind the scene with a group of JMOs and everything, and I was never seen because I was busy doing all the
Yes.
discharge summaries,
Yes.
doing everything,
Hitting behind the desk, hiding behind the
and
desk.
obviously it was an inpatient department, so I was mostly uh, under the registrar. So the registrar would know what was happening, but when the consultant wrote the report, he said, "I've never seen you."
Mm.
I thought, well, I'm doing what I'm meant to do, which is clearing up all the backlog of all these discharges. I've done like 150 discharges within the first 2-3 weeks to clear the backlog for the department, and this is what I thought one of my jobs was. Um,
Yes.
so, but they said, no, you need to also do clinical work. I said, I'm really sorry. There is a misunderstanding here. I really want to actually make up and let me know how I can actually change. So it is also about just finding out where your difficulties are and also approaching them and saying, okay, what do you exactly want me to do? And being a bit more visible, and not thinking that you're doing something means you're doing the right thing. There is a clear hierarchy where you are responsible to be available, to be responsible and accountable for what you're doing. So what happened was I actually showed them all the discharge summaries I did to actually
This is the
prove that
proof.
I, I, I was lucky that due to electronic medical records and everything, I was able to download all the things under my name.
Yeah. Yeah.
And I said, look, this is genuinely what I actually did. And they saw, okay, you actually did all this work, and you were doing all the hard work that nobody actually sees. And they
Yes.
realized that is what has actually happened. And I was lucky in that way. Sometimes some of these can't be quantified. Sometimes they are difficult to prove. And these sort of situations can happen from time to time for IMGs. And the only way then is to say, look, I'm really sorry, there must be some misunderstanding. How can I change,
Yeah.
or how can I
Yeah.
improve?
Yeah.
And showing, not only saying those words, but showing the genuine interest in changing your professionalism, improving and enhancing your abilities and skills, and also following it through. I think those are very critical in the beginning, and in the first few weeks of the term, and also the first few terms for any IMG. And
Yeah.
I think if you are doing that consistently, and it is easily noticeable. I don't think
That's right.
anybody can actually give you a bad kind of a report, or a term report. It is as much, this is prevention rather than cure. So
Yeah.
here the systems are slightly complex, the expectations are different. Sometimes we may not get the expectations, we may not understand all of them, but these are some of the things that are uniform. You just show
Yeah.
that you're keen, you're
You need
working
to be
hard.
visible. You need to be in front. Like, I mean, that's pretty
Yeah.
much the fact. And just relating to your experience, when I was in the UK and I was doing this rotation, and that's back again in 2005 or 4 it was. And part of that rotation was through surgical, like I was doing an orthopedic term, then I was doing a general surgical term, or colorectal term it was. So basically exactly the same thing, Shashi. My consultant said to me, "You're never here. Where are you?" Well, I said, "You're an orthopedic surgeon. You are always in theater, but I'm actually doing all, the patient bloods and sending, discharge summaries to typing them off and doing all those things after the ward round. Because after the ward round, you've got a list of 20 things to do, and being the only junior doctor on the team, because there was a registrar, there was a resident, and there was a consultant, and there was another registrar. So they would leave everything to me because they need a cutting experience. So I was here doing all that thing, drawing bloods, chasing up the results, doing the discharge paperwork, doing the admissions because I was carrying the pager, or a bleep it was called in the UK, doing the admissions from emergency. So I was not visible. So consultant, no, you need to come to theater because we've got most of our week occupied by theater dates, and I've never seen you there holding a retractor or something like that. And so I took that point on board because I could. That was the end of the term which I got. But when I went into the colorectal term, I made this point at my first in-term assessment that my expectation is actually to spend more time in theater. I want to learn basic procedure like, abscess drainage, appendectomy, and things like that. And my consultant, you should be doing that. And everything else, as long as you're able to prioritize your work, some in the morning, some between the breaks, and some at the end, I'm happy with that. So the patient clinical care at the wards should not be compromised at the expense of your learning. And I thought that was a very fine balance. But you're right. I mean, I can relate to some of that. So moving on, how is your personal life now in Adelaide? So it looks like you're spending a lot of time in the hospital and trying to meet the expectations of the consultants and all. How's your social life back in Adelaide?
Yeah, look, I was single at the time, so we were just hanging out with some interns. I think I was fairly focused because what happened was because
Yeah, that's what I was going to
at
ask.
that
Like, did you
time,
start to apply for emergency training programs at that point? What happened?
no, so to start with, I think I was doing internship, and that gave a very good platform for appearing for the AMC clinical.
Mhm.
And I appeared for my AMC clinical as part of doing my internship, and it made it so much easier. Obviously, having the workplace experience directly and working in the system made it so much easier.
So, did you do a WBA or did you do AMC clinical?
I did the AMC clinical. There was no
Okay.
WBA at that time.
At that time, yes, I thought
Yeah.
so. Yeah.
So by 2007, I cleared my Part 2 AMC, and subsequently the following year, I joined emergency medicine training when I realized, oh, I can get my days off on weekdays. and that's when I started. I was fairly focused, and I think I'm the sort of personality. I think whether for good or bad, I just want to finish the task that I'm given in a way. So I wanted to do the training as soon as possible. So I was on the training belt pretty much. And around that time, my wife, I wasn't married then, but she moved to Australia too. Her sister used to. She also came from India, and she came a few years before that. So she came to visit her sister, and we kind of connected at the time. And then we started dating, and she came over, and that's how my personal life kind of started out here.
Building up. Okay, all in
Yeah.
Adelaide. So things can happen in Adelaide. You can find a partner there too from India.
No, we knew each other from back
Okay.
in medical school. She was 1 year junior to me.
Oh, so you
So
were like you had the target in mind.
yes. So
Person of interest.
yes, we were great friends when we were in medical
That's
school.
how it always starts. Come into the friend circle and then narrow the circle till you achieve your target.
Exactly.
All right. So you started your emergency training, and obviously you said that you liked being in emergency because it had so much to offer. It was an amalgamate of all the specialties, but you also hated it at some point. How was this love-hate relationship? Obviously, because when you're joining the training, you must be, purely committed. Was that love-hate relationship from your intern days was still transpiring through, or was it like, no, this is something right? I've made the right decision. I could see myself evolving there. Because some of the
Yeah.
IMGs could say, oh, look, I'm not interested in hospital medicine. I want to go and become a GP. And that seems to be a very common trend, or want to do a medical specialty. That's the other common trend. So were your expectations like in the first few years in emergency?
So I did.
And that
did
was
not
still in
like
Adelaide? Still in
Yeah,
Adelaide.
I started. Yeah, I still in Adelaide. So I started hating emergency for only that one term, not afterwards.
No.
And yes, there is a bit of love-hate relationship with every profession or any specialty you would pick, but the love obviously outweighs in the end. We often tend to focus on all the things that we don't like, but there are many things that we often take for granted that we like. So on the balance of things, it is now a huge love and a small hate kind of relationship.
Plus the money starts coming in and shuts the rest of the plug holes.
Yeah, exactly. Look, I think one of the things I think the financial security for anybody starts particularly as an IMG in Australia once you get full registration.
Yeah.
Before that, you might earn money, but and you'll be paid handsomely compared to any similar job back home. But the financial security and the ability to apply for permanent residency, if you haven't already got it through a partner visa or something else, gets established after you get full registration. So the first a huge step, or the one and only big step, is you're getting your full registration. And afterwards, you pick any specialty training, you balance your work and your life, and you try and find what sticks to you. Emergency doesn't stick for everyone. And I was a DMT up until recently for 4 years. And this is one of the common discussion that I have with any junior doctor or IMG who is keen on doing emergencies. I ask them, give me one good reason for work and one good reason for life, why you chose emergency medicine, because you need to balance both of them. And it's not just one or the other. They both need to work seamlessly or as seamlessly as possible, or whatever the compromises you're trying to make, actually don't overburden one or the other.
So fast forward a few years, and here we are at the stage of fellowship exam. How was the experience for you? What was your regime like? Tell me about it. Like, how did you approach the whole situation? Were you putting in a lot of, because it looks like you were very organized when you were trying to get into med school, as you said, that you had a lot of inspiration from your dad, your brothers and sisters. Here, you're all alone in a different country with a different expectation in terms of professionalism. How did you organize for a fellowship, the mammoth fellowship exam? It's one of the toughest exam, obviously. It's being called. How did it work out for you? Tell me, take me through that.
Yeah, as you know, advanced training in emergency is 4 years. I only, after the primary exam, the first 1 year was, I would say, the initial relaxed, cruisy year.
Yes, the time flies.
Time flies. So even from second year advanced training, I've been thinking about how to prepare for it, because I was probably a bit nervous that this is a huge exam, and that seeing some other senior colleagues not get through, and understanding the implications of not just progressing in your career and missing out on professional career advancement, but financial, challenges, all those things. So I started to realize that this is a immensely big kind of next big hurdle. The big hurdle initially was the AMs for an IMG, the AMC, and getting full registration. So that was the hurdle that I cleared, and I had a few years of happy chappy life. And now this was the other big mountain. At one stage, it was really an insurmountable mountain, and that's how I felt for many days leading up to the exam. And I was.
So how was your timetable like? Tell me through it.
It's not so much the timetable. I think what I noticed.
So when did you start preparing for the fellowship? And I think this is a very relevant point. Because yesterday the fellowship exams results have come out.
Yes.
And I was doing a Liverpool shift yesterday, and they have had 7 out of 7 success.
Yes. That's great.
That's amazing. And some of them are IMGs actually.
Yeah.
So I was quite happy. One of the IMGs was actually coming in for, he said, Rizwan, I'm coming in for my last night shift. I've had enough.
Exactly.
So tell me, I think so many IMGs are obviously taking up emergency.
Exactly.
How was your strategy?
I started more or less from year 2.
Okay, that's really
not for the exam as such. I started to realize that I needed to take decisions for night shifts and everything. I wanted to be even more independent. I was thrown into doing night shifts as soon as I finished my provisional training. So after you've been through that, you wanted to be better on everything. And I was trying to learn being a good emergency physician. And I realized that the exam was a great pathway and a tool. So all the tricky questions that I ask myself are being asked in the exam anyway. So when I was in Coffs Harbour, so this is where I did advanced first 2 years of
So you've
advanced
now
training.
moved from Adelaide to mid
Coffs
North
Harbour.
Coast, yeah,
Yeah.
or North Coast actually.
Yeah. I've finished my primary exams in Adelaide and moved up to Coffs Harbour in New South Wales. And there I basically said, look, I know I'm quite away from fellowship exams, but I would like to catch up with you guys. So it was my emergency consultants on their admin days. Say, look, can I just sit down with you and go through some of these skis, the short. So they were just
That's
really
the old format exam, yeah, skis, yeah.
exactly.
Short,
So
structured questions or something
structured
like
clinical
that.
examination. So
Yeah.
it was. So what I used to do was
That's pretty much the OSCE format now, right?
exactly. So I would at least once every fortnight meet up with my DMT or one of the
And that's in your
emergency
year 2.
physicians. Yep.
Oh wow.
So I was going and chatting up with them, catching up with them and saying, look, hey, let's do this ski for half an hour, 1 hour, a couple of them. And I was doing it once every fortnight or so. And on a kind of more or less semi-regular basis. It was dependent on their availability and my shift.
And was there a structured teaching program for registrars? Because obviously every department has got their own teaching program.
Yeah. So Coffs Harbour at the time, I was the only advanced trainee. And part of this was also my own education, registrar education that's built into this. So that's how we kind of balanced everything. And so I was trying to say, look, this is the kind of way I would like my education to be. Because at that time, there were no WBAs, there were only ITAs.
That's a very good way of actually planning your own, waypoints that, look, I need to do it on my own. There could be some didactic teaching, weekly teaching, but I would like to actually focus on the exam. So when did you really become more focused towards, okay, fine, I've submitted or I'm going to take the exam next year? Or
year 3 was where I finished enough time in Coffs Harbour, so I had to move. I went to Princess Alexandra Hospital in Brisbane. I moved up to Brisbane. And there was a consistent group of peers who were sitting every 6 months. So every 6 months, there would be
like
5 or 6 advanced trainees who would be sitting the exam. So that got me into you got into the conveyor belt. This is the tertiary center. There was a tertiary time for me too.
So that's a very important point, Shashi. So you think it's advisable to be in a tertiary center hospital emergency department when you're thinking of doing the fellowship, because you've got the resources, you've got the teaching, you've got the collegiality with the rest of the colleagues, you learn by absorbing them. So is it more advised? Because sometimes people think, oh, look, I need to study, I might just do locums or go more rural. What do you think? What is your observation? Because you tend to do a lot of courses for fellowship, and what's your feel like? What's your take on this?
It is a bit individual, I have to say. Everybody's preparation style and everything are different. What I would suggest is wherever you are, you need to identify key FACEMs who are going to be supportive, because what you're trying to do is learn the emergency medicine mindset. And what that emergency medicine mindset is something that you learn as you are practicing emergency medicine, seeing others, particularly your FACEMs, practice it, and basically learn the ropes of the way of this skill.
That's right.
So I would be biased by saying that tertiary is the best place. Having said that, any place can be a good place. I would not.
But I agree with you, because I remember I was at St. George Hospital in Sydney, and the DMT over at that time was Trevor Chan, and he said to me, you need to come to your mothership when the exam is close, because we can accommodate your leave, we can help you doing the practice sessions, we can also look after you, because there are other people. So on the admin days of the consultant, we can done practice scenarios, we can do the mock exams, and they did that. So I agree that there's probably better opportunities if you're coming to even back to your in the final year, lead up 6 months lead up to your emergency fellowship exam, you should be in a large tertiary care center with lots of FACEMs, young FACEMs who can help you. So okay. Absolutely. All right. So how did your exam go? Tell me about it. What was it like?
Oh, the exam was still nerve-wracking. Um,
Oh,
Even though we put in hours and hours and hours of preparation, there was so
did
much.
you have a study buddy?
Yes, Allah was my study partner. So
Allah,
like,
yes,
yeah,
the famous
Allah,
duo, Allah and
yeah,
Shashi.
Allah and I, yeah, we have. That's where we. So in while I was in PA, Allah wrote the exam 6 months before I was planning to,
Mhm.
and he was unsuccessful. And
Mhm.
that's when Allah and I. We were getting to know each other by that time, and then we kind of said, let's do study together,
Yeah.
and we became study buddies, and then we sat the exam together. We practiced lots of trial exam papers, all sorts of things. On the exam day, I was a bit nervous, but I think
So tell me,
that's when
when you
I
said study buddy, sorry, I'm cutting you off. How much time were you spending together on a weekly basis?
look. The way it ended up being is whatever extra spare time I have, that's for preparation.
Okay,
There's,
so pretty
there's
much
nothing
like,
else.
so it's either work or studies. It's nothing else.
Yeah, you limit
And
everything to
that was not the
bare
time of
minimum.
Zoom or Skype. Were you
No,
doing Skype?
no. Either Allah would come to my place and we study together and we write exam answers, and either I would go to his place and we just go between places, and then we have paper pen. We just sit in front of one another, timer,
Just
write
quizzing each
exams.
other, yeah.
Yeah, and there are times even when right before the actual exam, like a few weeks before, what we did is we booked rooms within hospital for certain times, like morning 9 a.m. to that particular time, because that was the VAQ time.
Hmm.
So exactly 9 to 12, we would book those days, and we both come in thinking that we are coming to the exam, and we have a trial exam paper of some sort and just write. And so
Wow, it's
we
very
were
organized.
yeah, we were writing on the same exam paper. We were writing using the same pen that we'll use in the exam, the same time, and of the day, and so various things. It is like a dance or
Full
ice
dress
skating.
rehearsal. Yeah, yeah.
Yeah, exactly. So you're doing exactly what you're meant to do, and we did that consistently. And then on the day, most of the things were okay, and due to that I felt like I was able to complete all the questions to time. I was able to also write all the things I wanted to. I was still nervous that I'm going to flunk although I did all of those things. So that feeling is still I can immediately go to that any moment.
I think a little bit of anxiety is good because it keeps you on your toes. At the same time, if you're completely relaxed, then you can easily, the pendulum can swing the other way around, and you can be relaxed and you can make a very good preparation being overconfident, and you can mess it up. But if you're a little bit anxious, the right amount of anxiety, they say, is a perfect recipe for success. All right,
Absolutely. I think,
so
yeah, going back, I think that is probably what has driven me to prepare for the exam too. That level of, okay, let's not take anything to chance.
mhm.
And also that little bit of being a bit more, having a bit more buffer, having a bit more safety. Those sorts of things were constantly part of the preparation.
So Dr. Shashi, tell me now, the day when you got your result.
Yeah, I
It's a
think,
very special time in every
yes.
trainee's life. How was it like for you? Were you on a shift
No, this was back in the day where they finished the clinical exam.
and they give you a result
So
there and then? Actually, okay, yeah, yeah, that was the old format exam. Okay, okay.
yeah, it was the old format exam. So I had to come to Sydney. Sydney is where I did my clinical exam. For that year, it was in Sydney. So we flew down to Sydney. I did I thought I did okay on both the days. The second day, the skis were probably one of my best. I did them really well.
Mhm,
I wasn't sure about the long case, but the short case and the skis, I thought I would definitely get a pass.
mhm.
But yes, I think only so my wife was also there with me, and only the candidates were allowed first into the room where you're given the candidate things and everything. So obviously we we got the letter. I looked at it. passed, it was such a relief. And then the next immediate thing I wanted to do
Yeah.
was check what was Ala's result, right?
Because he's your studied up buddy, right?
Yeah, we went together all through the last 6 or 7 months of of the journey together. And the next thing I remember was he passed and he gave me this humongous hug. He almost cracked a rib or two easily. It could have. So he passed too. So that was really good. And then we had drinks. My wife was just there, obviously. It was lovely. I think without obviously her and all the time and the background, everything, it was really good. I was able to kind of celebrate that moment with her. She was there. And yeah, they gave a small pin and
Yes, the pin.
say that you passed. And yeah, that was it. That was it. I still had about 6 months additional training to go, but
Oh, that is a honeymoon period, because now you
yes,
got nothing. The only way
nothing.
forward is just to get a consultant job. You
Yeah,
start
exactly.
applying. So tell me, where did you take your first consultant position?
At here, at Central Coast in New South Wales.
Mm-hmm.
So for those who don't know Central Coast is a very big area between Sydney and Newcastle. Think about it as a sunshine coast of Sydney. So it's got lots of coastal living combined with lots of beautiful, lakes, mountains, waterfalls. It's a place that is heavily holiday driven,
Yeah, yeah.
and it's a really nice place. So Central Coast has two big hospitals, Gosford and Wyong.
Mm-hmm.
I took this position for many reasons. One of them, from a clinical point of view, was that I could work in two hospitals with just one contract.
Mm-hmm.
And I always wanted a bit of variety rather than just being in one place.
Mm-hmm.
Gosford was slightly bigger, one was slightly smaller, so a good mix of that. I was aware that compared to some of my other peers, I had less number of years before I became a consultant. So I was mindful to actually create a good level of competence early on in my specialist practice. So that was very attractive for me. And there are many other personal reasons, being close to Sydney, to an international airport, and the weather and the location, and the fact that these guys gave me a job 6 months before I even finished my training, all lined up and said, okay, that's a no-brainer. Let's just take it.
Yeah.
It was a move from Brisbane. It was also important for my wife. She was doing psychiatry training. She wanted to come back to New South Wales because the training was far better for psychiatry in New South Wales than in Queensland. Within her experience. So for all of those various reasons, it looked like the right place. And I've been here now. This is my 8th year, so I haven't changed.
Wow.
I haven't got any other. I didn't apply for any other consultant positions yet. I've done lots of locums, but I can quite safely say that Central Coast is home now.
Excellent, excellent. Now, you took up a DMT, Director of Emergency Medicine training position. How did you find that experience? Obviously, having a portfolio, and this is something which every IMG would look up to you, that you've taken up not only just the consultancy, but you've actually taken up some closer ties to the college, being a DMT, supporting the training of other trainees. How did you find that?
Look, after all the fellowship exam and the amount of help I got from every FACEM, DMT, and various other senior colleagues, I felt the need to repay them. And part of that was the reason why medical education was something that I got interested in, which allowed me to do a lot of things in addition to being a DMT. So from when I was finishing my training, DMT was a role that I could see myself being able to at least do something and also help others navigate this, having gone through my own challenges being an IMG, through emergency and everything. I thought I was reasonably well placed to kind of take on that role and its challenges and try and do my best in that. So I was lucky that I was able to take on a few teaching portfolios, particularly the primary exam train
Okay.
teaching and everything. And then that led me to the DMT position when it became available. And I did it for 4.5 years.
Wow.
And yeah, I was lucky to get one in second year of my FASM job.
Yeah, because you need to be 5 years out, right? Or
3 years,
something, 3 years out. Yes, yes,
unless you're a co-DMT. So I
yes.
started as a co-DMT and then became the DMT.
Fair enough. Yes, yes. So then, how was your journey starting your own project with uh, ALA, with AFEM? Tell me
Yeah,
about that. How did that transpire, and how's it been? Because this is, I think, where most of the doctors know you from. Uh,
absolutely. Yeah, FM
you're very
is,
popular in emergency trainees all over Australia, because they come from all over Australia to come and do your course. And it's
yeah.
a very popular course. And I think I would like to learn about both the course, how you've organized, how you structured, how it remains very competitive in the market, plus also your evolution as a course provider. How's it been for you?
That's a very loaded question. Look, I'll keep it simple. When Ala and I were preparing for the exam, we constantly felt the need that we needed a course of some sort that would filter through some of this high level knowledge, the particular language that is required for the course, and the ways to prepare. So we both were kind of joking many times, saying, "Okay, we'll put together a course if we were to pass this exam, and we can share these resources that we have created, because together we created a lot of notes,
Yeah.
lots of ways to answering questions. We were experimenting. We were trying to do what is the best we could do, all those sorts of things. Of course, we were getting a lot of help from our DMTs and everyone, but when then we come back and then go, okay, how do we do this? How do we do? They've said something, how to write this? They said this, how do I actually do it? This is the sort of process that we went through. So it was only natural that when we passed, we still, I think everybody will, each face will probably agree with me, saying in the initial bit, you are very grateful for all the help that you receive. You want to do something in return. And this is where a lot of young Faisans would feel naturally inclined towards teaching, not just fellowship, but also teaching in general. So we were in that same boat, except that we were probably a little bit more crazy. And we said, okay, let's just put a fellowship course together and share our resources for everyone. And that's pretty much what the start is, and it is as simple as that. And in terms of how and why we are competitive and everything, I've heard so many people tell me at various times, your course is worth $4,000 or $5,000. Why do you charge only this much? This is or all those sorts of things. And it goes back to the simple thing. We basically say the single aim of this course is to give a good course at an affordable price. That's it. This is where we don't look at competition, we look inside, we don't look outside. We say, okay, how can we do this better? And we have been lucky that whatever we did has worked out as well.
No, it's amazing.
So,
As I said, I
and
knew you from the course as well.
exactly. So partly I actually thank all the people who have attended the course, who actually spread the word about the course, and all we focus is on making the course better
So, how do
and
you
better
think,
every year.
Dr. Shashi, how much is the course relevant to the current exam, the new format exam, your course? Because you were obviously creating all the resources for the old format exam, but now the new format exam, how have you changed and evolved the course? Because it still remains very competitive and very highly sought after course.
So this is the most funny thing about being crazy. So
Tell me about it.
we both wrote the old exam.
Yeah.
And our very first course was towards the entire new exam. So very first course we did was for the
But
new
the
exam.
content is still the same. I agree. Like the questions and the
Exactly.
themes
So
are
that
the
is it.
same.
Look, the fundamental thing is emergency medicine didn't change. It's the exam that changed. Emergency, the things that are life-saving, the things that are relevant, the things that are critical are still the same. It is just the way the questions are being asked. And it is just that adaptation. We read the same briefs that were publicly available through ASIM that said how is a SAQ structured, how is a MCQ structured, how is a EMQ structured. We sat down and did exactly what we did for the fellowship exam when we did the preparation. We said, how can we translate this into a question? How can we translate this? And we were able to actually, and this is me saying in a proud but also in a very happy way, we were able to surpass the standard of the first ASIM exam, which is the new format. People have commented on online forums saying our exam was better. The AFM exam was better than the ASIM exam. And that was probably a silly comment, but we would be quite happy to take that comment any day. So in a way, we were nervous. We didn't know what will happen, but we said, look, let's put a course together, teach them the key concepts, how and what is actually demonstrating consultant level knowledge and everything are, what are the requirements. And that is what continues to be the course.
Fair enough. And how many courses are you doing now in a year? And how's the pandemic affected it?
So we are doing 2 courses a year that are usually 8 to 10 weeks before any exam.
And that's still the 2-day course, 3-day course, 2.5 day, the fellowship.
So we run it over 4 days. The first day is the exam, the trial exam, and you get both a MCQ and also the SAQ part. And then the next 3 days is the actual course, and it concludes with the review of your attempt. So people who have written the exam on day 1,
they get the answer back. Yeah.
They get their result and the questions and everything marked. For the SAQs, it's only the first 60 that get their questions marked, because we don't have the resources to mark the paper within 3 days. So you get the result on the same day, as in same course, and you can look at what you've achieved, and then you can look at the course content and go, where are my strengths, where are my areas of improvement, and then go from there and give you the next 8 to 10 weeks of preparation time for you to then refine and adapt your preparation if you have to focus on getting and using your time wisely and maximize every opportunity you have to get better answers and to get more marks.
That's right. So I remember when I did the course exactly like that. I had my questions marked as well, and it came at the last day, and I was surprised the amount of feedback which was given on each question was quite good. And I thought, look, I mean, this is a very well structured course. And at the end, you guys were doing a little bit of a closing remark thing, and you said, we've tested that many candidates and checked this many questions and this many feedback. So that was very emotional actually, and I really applaud the level of commitment and dedication that has gone into you. So what is more on the forefronts? What is now at your personal level and professional level? Obviously it's a side hustle business for you, and I admire you for that you've taken not only the professional DMT roles and working still as a consultant, but you've taken something very close to it in terms of teaching that you feel very passionate about and convert it into a secondary source of income at the same time, benefiting people because of your interest. Do you see that as going into a bigger platform? What's your idea behind it? What do you
Look,
think about it?
we started off with the simple idea of just giving fellowship exam preparation, and to this day, that is the core thing that we want to do. And as emergency physicians and specialists, that is our That's our specialty, that's our experience, expertise, and skill. So from that point of view, we would want to continue doing the fellowship exam preparation. And we see that continuing on. As long as there is ASEM, there will be AFM.
That's right.
That's a simple way of looking at it.
That's right.
And AFM has actually um, been an incredibly important experience in my life. It has taught me a whole heap of things I never thought I would learn. So not only has it given me a sense of giving back to the emergency or ASM or emergency medicine, it actually allowed me to grow as a business person, as an entrepreneur, as yeah, as a clinician, as a fellow colleague, and many things. So all of these things are part of it, and I'm still learning. I'm still learning a lot. One of the things that has come out of AFM for me early on was EMCQ practice. So EMCQ
Yes.
practice is a online, it's a website where you can go and practice trial exams. It is the same as writing an official exam online, like an
Okay.
MCQ exam. So everything is exactly the same.
How many questions have you got in there?
So there are spread across various trial exams and a study series. For the fellowship exam, there are nearly 800 plus questions
Very
that are
good.
being
Thank you.
constantly added
And
across.
that's with the explanation, with the if you do the right, like, and if you go the wrong, it give you explanation in terms of, okay, all right.
Absolutely. So that is one of the key things that every trainee would like, is to have some feedback about their performance. And these are integral to AFM and also the EMCQ. Is you are questioned, you are tested, but you would get to know what your result is, and also a brief explanation. So that is what is provided on EMCQ practice.
And you're just providing fellowship MCQ, or there's some other platforms there as well?
So currently, the website provides fellowship and primary preparation, primary exam
Okay.
for emergency medicine. And there is scope to provide other exam preparations. Any exam you can think about that has a multiple choice question can be
Incorporated in
hosted.
that.
Yeah,
Yeah.
hosted
And
on
what platform are you using for that?
This is a platform that we built that was specifically built for the needs for EMCQ. So it's a learning management software
Okay.
that is based off a WordPress.
Okay. Because now
And
there are
software.
very online courses. There are new platforms coming in, especially because of the pandemic. I think, Shashi, you've got to give it to the pandemic, and it has made us think in so many different ways. There are now platforms which existed before, but now have come in being more relevant. Zoom, as we're interacting right now, is one of them. And the course platform, Thinkific and Kajabi, are the platforms in which you can tailor-made your MCQs on it, with the feedback and everything in it. And they're a subscription-based platform, and they're very intuitive and very easy to work with.
Yeah.
But it's good. Like, I mean, if you've tailor-made your own framework, then it's always expandable, modifiable. Within those preset platform, you have to work within their domains. So in terms of your personal life, tell me, how's it shaping out? How do you balance it all? It's very busy, it's very occupying. You've got a business, you've got a work, you perhaps you've got family as well. How do you all balance all that?
Yeah, I think that was the other thing that I started focusing more since COVID as well. I think
Yeah.
previously I think you get the thrill of doing lots of things, but also you then realize, yes, it is taking a whole heap of time away from certain things. So prioritization is an important thing. I think more and more I'm able to prioritize more things. So some of the things that I really enjoy is obviously spending time with my wife. I think there are some dedicated times like dinner time and those sorts of things are specifically for home and enjoyment, like watching television, having dinner, having a chat, or listening to music. Going out on the beach to beach and holidays and these sorts of things, they're always going to be high up on the list of things to do, and prioritization comes from there. So for me, I think I had a moment when I saw a colleague quite badly affected by burnout.
Mm.
That was 4 years ago,
Mm.
and they were in quite a bit of strife. And one of the things that came out was, for me, when I looked at it, was their whole life was their work identity,
Oh dear.
and so the burnout affected them in a very big way.
Mm.
And from then on, I said, but work and whatever I do is not my identity.
Mm.
My identity is just myself. So
Mm. Mm.
from that point of view, I have three main priorities currently.
Okay. What are
my
they?
my my first priority is looking after my wife, as in being obedient to my wife. Or no, what I'm saying is I want to spend that as make that as a priority.
Yeah. Yeah.
The next is my rest of the family, including my parents. So I'm just checking with them and
Do you
being.
go often visit India? When was the last time you went to India?
I was some time ago, and and
Yeah.
there's a backstory to it. And the third priority is my health, and I think
Yes.
that's those are so. As long as on any day I feel down or anything, I go look. Have I done the priority one, priority two, and priority three? If I've ticked all of those, and I've just spent any time doing that during the week or during the day, I know I've done everything that I needed to do. So from
Mm.
that point of view, I'm clear. And then
Mm.
based on that, I build everything else. So
Surrounded.
everything
Okay.
else, everything else comes after these things.
Mm.
So
No,
from that
that's a
point of
very
view, I think
important point. That's a very good point. I was listening to this conversation in which they were saying having set low expectation for you is sometime important, because if you set up the bar like, hi, I'm going to do some teaching today, I'm going to do some work on my website, and I'm going to do some Zoom session, then I'm going to go and out with my wife or family or whatever it is, and then I'm going to finally finish off my days with the kids and their homework, then you're obviously set for disaster, because you can't possibly squeeze in all those tasks. But having three simple prioritized tasks, as you said, that this is what I'm going to tick boxes on most of today, and that's how the week looks like, then having a lower expectation for you and meeting those expectations is a positive boost, not in your personal life, but also your professional life. So both in personal and professional life. So tell me something, like there's lots of people who are going to be watching this podcast and conversation. What would you advise people who are thinking of coming, especially from India and Pakistan and other countries, IMGs in particular? Should they really consider emergency medicine? And how do you compare the standards of emergency medicine now here in Australia to back home
mm.
in India?
So look, anybody who is aspiring to migrate, I encourage them. I think for their own personal and professional
Mhm.
reasons, people are going to migrate. Once you come here, you have a choice of specialities. Once you've cleared your AMCs and you got your registration, emergency medicine is definitely something I recommend. Um, Not just because I'm an emergency physician and I need to recommend it. It is recommended with a disclaimer. I think one of the disclaimer is that sometimes work patterns are quite challenging. Um, and also the work-life balance, particularly doing after-hours work and weekends, and initially in your training night shifts. These sorts of things can be quite challenging, um, and you need to factor that into that. Uh, the other things about emergency medicine people need to understand is it is hospital based, as you said, and it is an employment related. So you're looking at employment. You can't have your own clinic or anything like that outside.
Mm.
And uh, these are certain limitations for the rest of our life. You and I, Rizwan, we will be doing evening shifts, weekend shifts, if not night shifts.
Mm.
We'll
Mm.
still be doing those. I think those
Possibly
things.
even night shifts, who knows, the way things are
Who
going.
knows? So these are the caveats or the disclaimer that I would say. Having said that, emergency is for those who want to have a broad skill base, who are comfortable with multi-system clinical medicine, who are not faced by the challenges of communication, time pressures, and work challenges. But what it does is it helps you shape and build your skill set, which actually is the biggest advantage. I call emergency medicine the iPhone of specialties. The reason is you can download any other app into it. Um, so I can go and work any other kind of registrar, senior registrar role once you become an emergency
That's
physician.
so true. That is so true.
So you become multi-talented. You are multifaceted in your skills. You have a whole heap of logistical, organizational, and leadership skills, in addition to just managing an ever-changing clinical sphere. So
Mm.
what it does is it is a perfect environment for someone who likes to be challenged, who likes to learn, who likes to grow, who wants to problem solve every day. But equally, this can be quite daunting and challenging for others who may not be. So choosing it wisely is what I would say.
Mm.
I would recommend it to for the right people to get into the emergency medicine, um, because of this uniqueness that you only realize once you get into it.
What about how does it still compare the standard of clinical medicine in emergency compared to back home with the advents of, the world is a global village now. Like there's more interaction now than it was 2 years ago, with these online platforms, and there's so much collaboration going on, conferences, courses, workshops, in person. How has it shaped emergency medicine back home in India, and how do you see these collaborations moving forward? In particular, what I tried to extrapolate it to, in the UK, their colleges are influencing their exams through foreign training, which I think is a very good idea. Trainees often don't understand that exam is a very small portion of the training, even though in terms of its impact, it's huge. But you can do an exam from any college. Do you see future in which a trainee might be able to move around in the country, pick an exam from a place to have some sort of authority and accreditation, being trained in other countries, especially back home, because that would be something huge for people who have trained back in India and Pakistan and other third world countries, and be able to come to Australia and do the exam. How do you think it's the medicine standards are equivalent, the teaching training standards are equivalent for this to be the next big thing for the college to consider?
Yeah, look, I think that's a great question. Portability of medical specializations across international borders is woefully lacking compared to any other profession. Medicine is probably one of the most highly regulated, um, uh, nationally regulated field of practice that requires cross credentialing, cross accreditations.
Mm.
There is also a divide between the Western world and the developing world medicine, and that differences are getting smaller. I haven't practiced in India or in any other part, so it is probably not very wise of me to make statements or assumptions around what they are like.
Mm.
But hearing and looking at the landscape, I don't see these heavy ironclad regulations dropping off any time. There will
Mm.
still have to be some sort of accreditation, and I actually will support that. The reason being, it is clinical safety.
Mm.
This all of this comes back to clinical safety of the particular patient, and it applies equally, because I don't want to now, just because I trained in Australia, be allowed to practice in India straight away,
Mm.
because there are many aspects of clinical medicine that I don't know in India. So my level of infectious diseases knowledge is extremely woeful. So if I go to India and look after a patient with sepsis, I'll miss many diagnoses. So that is a problem.
Mm.
For those reasons, this fluidity may actually be quite challenging and difficult, because at the end of the day, patient could be harmed. So even one patient harmed by this is not enough. It is too much. I mean, it is probably safe, and I actually would support this processes that IMGs have to go through too, like coming into Australia. They have to go through the AMC, they have to go through these things. What it does is, for the trainee and for the person at the IMG, it looks like a huge barrier. It almost feels like, why are you making me do all these things? They ask this question, but the reality is it's actually making it safe for the patients. There is a certain amount of orientation, induction that needs to happen to understand these extremely complex systems that are already established locally here, for you to safely manage one single patient. And these are the barriers of entry, but these are actually a basic minimum standard of care. In Australia, the standard of care is really high to start with. So you just need to meet that standard. And that's why people feel the challenge is quite insurmountable, because the challenge to meet that standard is high. Having said that, the standards are rising quite nicely in developing world. And I said the gap between the westernized medicine and developing world medicine is narrowing. So there could be a possibility that we can still look at something like this in the future. Having said that, there are so many geographical and regional differences in people's genetic makeup, their diet, their disease patterns, their health behavior. All these things are what actually makes it very challenging to have cross international fluidity and practice anywhere you can. It is not that. It is fairly complex.
That's actually, you've put it in a very nice way. So you're basically thinking that these are all the measures for the patient's safety based on the demographics, which are very unique, and that's why Australia tends to sort of pride themselves almost to a degree to have a very robust training pathways and very strict and stringent testing systems for their own training pathway. It's almost, if I was to draw an example, Shashi, I would say it's like an iPhone ecosystem. They're not cross-platform. What they do is for their own platform, as opposed to Android, which is, you can use it across and it's a free open resource. But I think at the same time, what was I thinking about is, back in the day when I was in my medical student days and internship back in Pakistan, we had the consultants who were trained or qualified, trained in Pakistan, but they did the FRCS exam, MRCP exam in the UK, which still remains a very popular exam back home in India and Pakistan and even Bangladesh. So they've done all their training in there, but they've sat the exam in London and then come back home. So I think at that time the need was there, because at back home in Pakistan the college was not established, the specialties and they were examining system which were not very good. But now the college is there. Obviously, they've got huge following of setting up the examination processes, learning from other overseas colleges. So you're right. I think that this gap will narrow, and I think if anything, in the last couple of years we've seen is that how very similar we could be when we're hit by one pandemic. In terms of our priorities of assessing the patients, cohorting them, and what works and what does not work. A single vaccination made in Germany and anywhere is applicable. So I think that's something which we need to come out of our shells and really open up this debate at some point. That should we have more...
Definitely. Part of the debate which you quite nicely outlined is the fact that there should never be any barriers to knowledge sharing. There should not be any barriers to sharing medical knowledge and advancements, and which is what I have benefited by reading textbooks written in UK and US in Osmania. So I said that there are two aspects of this discussion, which is knowledge sharing and advancements simultaneously. So what that does is allows local people to apply those newer developments, shared learning, and better healthcare provision in those places. The other challenge is whether to allow clinicians to go and practice in different jurisdictions. I think that is what I was probably focusing more on, and I think you added the right amount of additional information, which I would want to clarify is there should never be any problem, collaborating with anyone in the world to try and make something better, because that's how you use the collective wisdom and accelerate progress.
That's good. So I'll thank you very much for your time today, but I would like to end on learning two more things about you. What's your favorite pastime hobby? What would you like to do in terms of relaxation?
Relaxation, I like to sleep. I sleep a lot.
That is very, very underrated.
I sleep about 10 hours a day on average.
That's good. No, that's good. And finally,
but I do like various activities. One of the things that I love recently, which I picked up, is squash. So I like playing squash a lot. And that keeps me fit.
And are there good courts there in
yeah, there are very few, but there are enough. I'm actually going after work today in the evening to go and play a game of squash.
And how long do you play for? Like every week? How many hours?
I would play probably between 2 to 3 hours a week. So this is one thing this is part of my health prioritization. So
have you got an approval for Big Boss?
Yeah, of course. She was always number one. She's number one priority, so she can't say anything to the third priority.
And lastly, Dr. Shashi Kalava, thank you very much. But lastly, before I let you go, I know your time is very precious. Can you share a beautiful prose, that one which you think of? We were talking about that you like prose, and sometimes prose can be very heavy-handed and can summarize. Can you share any prose or any poetry that you like?
Oh, no, look, I'm actually obsessed with words as such.
Okay.
So if you allow, I will probably share two things. One is a thing that is in my signature for my email, which is never stop learning. It's a common word. You see it all the time, but I think it does mean a lot to me. It's like I'm constantly trying to learn something new or be excited about learning something new. So that's one of the things. And as part of doing the fellowship exam, I developed an obsession and a healthy obsession, I have to say, about words, because words are extremely important. They communicate a level of emotion, and that is what fascinates me. Is a simple change in a word changes a whole context and meaning.
Yes.
There are two words particularly that I share this at courses that I do, but also in general, are two words, which is appreciate and acknowledge. And these are something that are extremely important. Many people in our lives are constantly helping us, are part of us, and just the simple thing of acknowledging what they've done is really important, and doing it in front of them and telling them that, and also appreciating them. So this is the other two words that I want to share with you, which I share with a lot of people, are extremely important. And going with my own example, I would like to acknowledge the things that you've done as an IMG. Your journey is as inspiring and fascinating. And I want to appreciate you for giving me this opportunity for talking with you.
Thank you very much, Dr. Shashi Kalava. I hope we meet in person someday as well. And it was lovely talking to you. Thank you very much.
Same here, man. Cheers. Okay.
All right.